David and Dana, baby Ray, what went through your mind when you saw the danger frontline workers are going through?
Well, I'm fortunate to be on maternity leave right now because of this one. And we wanted to figure out how we could help everyone who's on the front lines right now, all of my colleagues, and initially felt a little powerless being at home. And then we saw the design of the COVID box being built in Taiwan. And Dave said, hey, I can adapt this and do this here. So then it became our mission to figure out how we could start making these and getting them out to my colleagues and those at other hospitals here, because we really just wanted to keep everyone safe while we couldn't be there. Well, I couldn't be there with them on the front lines.
So what happened to you two as a couple? You've got a young baby and you start brainstorming about this protective device. David, what went on?
Well, I guess Dana was showing me the WhatsApp group that the Sunnybrook doctors had, and one of the things that was posted on there was the protective intubation box from a doctor in Taiwan, and they were saying, wouldn't this be great to have at Sunnybrook? And I thought, it's a plastic box, surely we can make that box. So that's really how it all got started. That's how we had the idea.
Okay, and it's been getting great reviews on GoFundMe. What difference could this box make, Dana?
So intubation, or putting in a breathing tube, is one of the times that providers are most likely to be exposed to the virus because aerosols, or the small droplets of the virus, are produced during that procedure, and the provider needs to be right over the face of the patient. So this box is just a crude way to separate the doctor from the patient in that most vulnerable time.
And David, what hurdles are you facing in getting it manufactured?
So one hurdle is just the price of the polycarbonate plastic has doubled. Everybody's using these. You see them at the grocery store, you see them at the bank, everywhere you go. So procuring that plastic has been one hurdle. Another one has been the shipping and the distribution, working with different hospitals. Each hospital has their own requirements, and they test it and they say, can you add this? Can you take that away? So just navigating that approval process.
What do you think access will be like? Hospitals able to pick it up? You no doubt you're going to meet the GoFundMe goal. Are you going to be able to start production and then actually get it to the front lines?
Yep, we're producing another batch today. We have a manufacturer lined up, and there's actually been people who have reached out to us all across the country that have stepped up and said, I have some plastic in storage. I have machines that are underutilized right now. So we've seen groups already take our design and build them and distribute them to hospitals in Stratford, in British Columbia, Vancouver. There's been a group that's done that. So that's been a success in terms of getting these out quickly.
Okay, Dana, what does it mean to you as a frontline emergency room doctor? You're also an instructor, to see this kind of rallying.
It's really been great. There's chats every night that everyone is dedicated to after a long day of work to sustain this project. It's really been just so encouraging to see everybody's heart to just keep people safe.
You both tuck into your prayers and your faith in God for many things in your life. How is that impacting your approach to this project into COVID?
COVID has been, for us, a time that we've been largely locked in our house like many people, and it's hard to know how you can help. So this was just one small way that we thought we could hopefully try and make a difference, and it's been it's been a great experience, very rewarding.
Yeah, I think we're just very thankful that we have a house that we can shelter in, and food and all of those things to keep us comfortable when other people don't have those things, or other people have to leave their comfortable home and, like we said, go to the front lines and do these procedures, intubation, where there's such a high risk of exposure. So we just feel so blessed to be safe and just want to keep others safe.
All the best, you guys, with the COVID box, and I'm sure it will be making its way into more hospitals. Thank you for your good innovation.
Thank you, Lorna.
Thank you for liking, commenting, and subscribing. What do you think about today's topic? Let us know in the comments.